Hello, welcome back to Caffeinated Nurse. If you're new here, my name is Faiza. This is a channel that is all about nursing school and nursing in general. A big thank you for my returning subscribers. I appreciate the support and the love. Thank you so much. Today's video, going to be talking about nursing school and the clinical assessments. I will be sharing with you 5 tips that you can use so that you can prepare for your assessments, and for sure it will become easier for you in your upcoming assessment or even in your future assessments. And with that, let me just start sharing those 5 tips. Before I begin, I know clinical assessments can be stressful. The thing is, there are some ways that you can try to incorporate during the clinical so that you can be able to get ready for your assessments in good time. The hardest thing about assessment is that you're expected to do your best, like almost perfectly. Hence the high pass mark for that assessment. But don't worry, with what I'm going to share today, probably you'll find it easier if you're going to implement them, and I hope you do. The first major thing that you need to do to prepare for your clinical assessment is actually start preparing it the first day that you get into your rotations. Or some of you might say, no, it's hard because you're not even familiar with the environment, you don't know anyone, you don't know how to do anything. The truth is, the sooner you start getting used to the environment, to the people around you, to the patients, the easier it's going to become for you in the upcoming 2-3 weeks until the assessment day. I would advise you to get familiar with the environment, with the nurses there, with the policies, because the policies differ depending on the institution that you're going to do your clinicals. That is, if your school changes the institution every now and then. On that first day of your clinical, try your best to attend to, if not observing, attempt to do the procedures that are being done by the qualified nurses. But there's a catch about this. You'll realize that the nurses that are already working, they have shortcuts, and this is understandable because there's too many patients to attend to, and most of the time there's a shortage of staff. So they adapt by finding a way that they can attend to all patients effectively and without wasting too much time. Don't get caught up doing these shortcuts. Most of the time it's not the ideal way to do the procedures or how to attend to your patients. Having scanned your environment, you have studied the nurses there, you can be able to even identify the kind of nurse that you'll want to work with. There are some nurses that are not friendly, but there's always that one nurse that everyone that is friendly to the students and he or she is ready to teach the students. Get close to that nurse. He or she can guide you on the procedures, and if he or she is doing the shortcuts, you can, and you know that this is not how it's supposed to be done, you can ask, and I'm pretty sure they'll tell you this is not the legit way to do things, but the legit way is this and this and this and this. At times there can be too much work to be done, so the nurses don't have the time to explain it to you, or they don't have time to sit with you and teach you. So it's up to you to go to that procedure manual and identify what steps should be taken, what kind of interventions should be done. When you start doing these things on the first day of your clinical rotations, your assessment become way easier. When I realized this, I was like, why didn't I do this from the start? It had reduced my stress levels and I was ready. If the clinical instructor will say, we might be doing the assessments tomorrow, I'll be like, okay, I'm ready whenever. What I'm trying to say is just take the initiative to start preparing for the assessment from the first day. I guarantee you it will be so much easier for you. The second thing that I'm going to share with you today is that prepare all the tools and the supplies that you might need for a procedure the previous day, just before the assessment. If you start looking for things that morning of the assessment, trust me, your brain will become disorganized. You'll even end up forgetting things that you know, like ordinary things. All that can be avoided if you just prepare from the previous day or even the first day of your clinicals, whichever. This takes me back to my first point, that you'll have to get starting used to the environment early enough. This will help you to identify where you can get your supplies supplies, how you can get your supplies, who can help you when you run into some trouble. You'll also be able to identify the common illnesses in the ward or in the area that you are working. Having figured all that out, you'll be able to identify or decide on the procedure that you want to do. That will make it easier for you to identify the tools and the supplies that you'll need for that procedure, so that you can just arrange them. They're just waiting for the assessment. And remember not to be afraid to ask for help. If you need help with something, there's always someone who is ready to help you. Get comfortable with those nurses at a professional level. You might get too comfortable with these nurses and it might pose a risk to your clinicals or even to the nurse's career. I understand that some of the schools don't have that luxury of deciding on what kind of procedure you would like to do for the assessment. Having been familiar with the environment of the ward, with the nurses there, with where to get your supplies, it will become so much easier for you. You'll be ready to do anything that you are asked to do. And also, preparing supplies and tools is not the only thing that you need to do to prepare for that assessment. Having done that in advance, you'll be able to focus on other things like going through your notes or preparing care plans for the patients that you're going to present. Third tip of the day is build your confidence. This is important because you'll seem like someone who knows what he or she is doing. If you're not confident during that day of the assessment, you'll destroy the relationship between you and your patient. The patient will start being anxious, like, it doesn't seem like they know what they're doing. It will be hard for your patient to trust you again. And if your patient doesn't trust you, he or she will not cooperate with you when you're presenting in front of your clinical instructors, and that's embarrassing. You know, people think that becoming confident is such a hard thing, but it's not, especially when you have had time to prepare for it. Then confidence just comes automatically. So let's imagine this scenario. You have clinical rotation for 4 weeks, right? You're supposed to have the clinical assessments on the 4th week. So you have 3 weeks in between to prepare for that. Example of a procedure like wound cleaning. If you started practicing on it, you know the legitimate way to do it from the 1st week, then once or twice in the 2nd week, twice or thrice in the 3rd week. Then when the assessment is up, you don't have any trouble to do the procedure when your clinical instructor is watching. You'll just feel like this is something that I have done every other day and I know what's supposed to be done. You don't have to imagining and manifesting confidence 30 minutes before the assessment. Don't be overconfident. That's not a good look on anyone. There was this one time, this guy had a clinical assessment as they're coming to an end of their rotations. When the clinical instructor tried to correct him on something he was doing wrong, he was like, no! I've been here the last 4 weeks, so I know how things are done. The clinical instructor was like, one main thing that I used to get ready for my clinical assessment and build my confidence was actually creating scenarios in my head. I will simply imagine myself doing the procedure over and over. If I felt like I forgot something or something is not clear, I will then refer back to my procedure manual. Never forget that book. Your clinical instructor expects you to do those procedures in that manual the way they are written. So you better start studying that procedure manual like a novel. I'm joking. No, I'm serious. You can try this imagination trick. Maybe it will work for you. The 4th tip is that don't forget to read your notes. You might master how the procedure is done, feel like you're perfect at it, but when the clinical instructor asks you, what's the rationale of you doing that? Going through the notes will help you get ready for the oral part of the assessment. You can be able to explain. Higher chances are you're going to pass that assessment. If you feel like the notes that you have are too much for you to go through them before the assessment, you can use websites like Nurses Lab. That's a good website. It has questions and answers, and pretty sure if you go through them, you can be able to answer any question that comes your way. The last thing is, what do you carry on that day of your clinical assessments? It all depends on what you feel you need. Some of the assessments, the clinical instructor expects you to take some notes. Documentation is important. I also made sure that I had a notebook. This was important for me so that I could write something that I could easily forget. For example, the medications that were prescribed for my patients, and also carry any other thing that your clinical instructor expects you to be having on that day. When it came to assessments, my classmates will kind of sacrifice me to be the first one to start off. Some of the times it will give me some kind of panic attack. I would immediately have a stomach upset. Be prepared for anything. There was one time that we were doing an assessment, and as usual, I will be the first one, but I didn't feel like I was prepared enough. And this was the mental health assessment. The lecturer that was teaching us was strict. He wouldn't even smile at anyone. He wouldn't even tell you to calm down. It's going to be none of that. So it was just me, my stomach upset, and my unprepared brain. So he asked me to present what my patient has, the condition of my patient, and I started very well. I said the age of the patient, her history. When it came to the point where I was supposed to present the prescribed medications, I had a thought block. So my heart starts racing, my hands started shaking and sweating. So the only thing that I had to do was to cry. The co-assessor asked me, "Do you need some time?" I was like, "Yes, please." I recollected myself and I remembered the drugs, and I went back and presented. So to avoid situations like this, be prepared to do your assessment from the first day. And that's it for today's video. Thank you so much for watching and catching up with me today. I post every Sunday, and also don't forget to subscribe. See you next time. Bye.